Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 17, 2025. This video is on an article published in JACC Asia, available online yesterday, 16th August 2025. Titled South Asian Representation in Cardiovascular Disease Randomized Controlled Trials, a Systematic Review. South Asians comprise about 25% of the global population, about 2 billion people, yet disproportionately high atherosclerotic cardiovascular disease risk. Standard risk scores underestimate atherosclerotic cardiovascular disease risk in South Asians. South Asian ancestry is a risk-enhancing factor in clinical guidelines. Randomized controlled trial representation in cardiovascular disease studies remains poorly quantified. This is a systematic review of 310 randomized controlled trials from 2018 to 2022 from journals including New England Journal of Medicine, JAMA, Lancet. A total of 1,036,737 individuals from the whole cohort, and the South Asians were only 32,764 individuals, 3.2%. The inclusions based on self-report or country of origin. Analysis stratified by disease type, region, intervention, and year. Results and takeaways. As I said, South Asians, 3.2% of all participants, 1.1% after excluding ACS quick trial. No South Asians in trials on heart failure, cardiac arrest, or valvular disease. Only 0.001% South Asians in trials from Western countries. Post-randomization data, only 28,197, 7.3% South Asians, mainly from one trial. Enriched trials, example COBRA, BPS, Triumph, showed blood pressure control, but underpowered for major adverse cardiovascular events. What are the data gaps? No disaggregation by country, example Nepal, Bhutan, or Maldives. Half of eligible trials didn't report South Asian numbers. Just 6 trials had usable South Asian outcome data. The need for disaggregated enrollment and subgroup analysis is emphasized in this study. Multiomics and epidemiologic research is essential for tailored recommendations. Just to put it in context, the Indian subcontinent has a population of 2 billion people. India itself has a population of around 1.4 billion people. And there are only 32,000 enrolled in these studies. This is a great opportunity to include more South Asians and people from the Indian subcontinent in clinical trials going forward. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.